The China Current is honored to partner with AIDS 2020 Virtual, the world's biggest conference on global health. In a time of COVID-19, its leadership on science, policy, and civil society is needed more than ever. From fighting stigma to funding research, the conference puts a focus on health and how it impacts the way we live. For the opening of AIDS 2020 Virtual, I was humbled to interview Sir Elton John, David Furnish, Dany Stolbunov, and Winnie Byanyima. Here, we would like to share some of those conversations with you. Winnie Byanyima, welcome to the opening of AIDS 2020 Virtual. You know, it's always critical for us to engage and speak and learn from you as a leader in the fight against AIDS, but also as a moral leader at a time of COVID-19. How is this pandemic impacting people living with HIV and the community as a whole?
Thank you for having me, James. It's a great honor. COVID-19 has greatly increased the vulnerability of people living with HIV or people who are likely to be infected by HIV through disruptions of services. Both prevention and treatment services are being disrupted through lockdown measures that are applied indiscriminately. They are having the highest impact on poor people and on key populations. We're seeing more violations of human rights of those who already didn't enjoy their full human rights. We're seeing sex workers, transgender people, gay men being locked up and blamed for coronavirus, denied social protection services such as food. We're seeing violence against women and girls rising, especially in family settings. And we're seeing already fragile health systems being stretched. We're hearing stories on the ground of people having to choose between selling their ARVs in order to buy food because of impoverishment. So the impact is severe. We have sent out an alarm because we have done our estimate and we find that if the disruptions to production of commodities and to services on the ground continue for another 6 months, we could have 500,000 additional AIDS-related deaths, and we could have reversals of mother-to-child transmission of HIV back to where we were 10 years ago. So it's serious, the disruptions are serious. UNAIDS is on the ground, working with governments and communities to protect services, to keep them going, particularly in countries where you have a high burden of HIV. We are working on monitoring human rights and supporting key populations, women and girls, to defend their human rights. And we are also taking the best lessons from fighting HIV into national and global COVID responses.
Winnie, it's devastating to hear that our sisters and brothers are at additional risk because of COVID-19. And from what you say, it appears to be a build-up of crisis on crisis on crisis. How is this build-up going to impact the Sustainable Development Goals and our ability to achieve them on time?
You know, James, before COVID hit, we were already off track our HIV targets for 2020. We were not on course. Now, COVID-19 is blowing us off course, and we've got to fight with all our might to keep on track, to get back on track. But as always, a crisis is an opportunity. This is the opportunity for us to address the underlying inequalities that epidemics, pandemics thrive on and worsen. it's time for us to fight to have the right to health for all people so that it stops being a privilege for those who can afford and becomes accessible for all. It's not acceptable that today 100 million people every year drop into poverty because of medical bills, that on any single day 10,000 people die because they don't have access to medical care, and that 1 billion people cannot access healthcare because of user fees. So we have to address the issue of health systems that are prepared for pandemics. Never again should we find ourselves so unprepared for a pandemic. And health systems that address prevention, and health systems that give everybody their right to health and don't charge at the point of use.
Winnie, this is a very important time for you, not only as the leader of UNAIDS at AIDS 2020 virtual, but with the release of the global UNAIDS report. Once again, it humanizes the struggles and the pain, but also the opportunities. And this year you put a large focus on women and girls. Why is that?
Let's talk of adolescent girls between the age of 15 and 19 in Africa are 4 times more vulnerable to HIV infection than boys of the same age. That young women in sub-Saharan Africa, that's from between the age of 15 to 24, are twice as likely to be living with HIV as men of the same age. That across the world, 6,200 women and girls got infected every week with HIV in our report of last year. This higher vulnerability of women and girls is a result of the structural barriers, the social norms, and the structural inequalities that exist in society. It is because young girls are not in school in many countries. They are in unsafe settings, that young men and men have got a toxic sense of their masculinity, and sexual violence is justified socially, that early marriages happen, that little girls are deprived of their childhood and go to marry, often marry men who are HIV positive. There are many factors that drive this vulnerability. They are all to do with social norms, economic inequality, and social inequalities like lack of education. So we must close those gaps. And this is the year of Beijing Plus 25 years since the Beijing Platform for Action that set standards, targets for women's rights. We thought this is the year to then push an initiative that is helping to close those and remove those structural barriers that result in the higher vulnerability of women and girls. We're looking at the school space. I announced last year a new initiative because we know that girls staying in school for a complete round of education up to secondary, their vulnerability reduces by 50%. So we're looking in the school space. We will introduce their comprehensive sexuality education. We will support sexual and reproductive health services. We will support pathways to economic autonomy. All these initiatives pulled together in a school space will give girls a chance to reduce their vulnerability and be healthy and live better lives. So this is such an important area for us, particularly now as the world is focusing on taking us to the next level on women and girls' rights. So join us in this new initiative. We call it the Education Plus initiative to address girls and women's higher vulnerability to HIV.
Winnie, this is a proud moment for the AIDS family. So many of our own foot soldiers have given the COVID-19 response a huge jump start in science, in policy, but also in community. When we think of AIDS, of course we think about community, but what does community mean and how would you explain it to a new audience today?
I'll answer your question with a story of Thierry So, a woman in Phnom Penh, Cambodia. She's been living with HIV for 15 years. She's an HIV counselor. She gets up every day to help people do an HIV test and learn how to live positively if they test positive. She's now also a COVID-19 volunteer. She works at the Khmer Soviet Friendship Hospital, which was the first HIV center in that country and is now the Center for the National Response to COVID-19. She helps her community, again, to find people to do the test, to do the contact tracing, to isolate, to counsel people and communities and campaign for change behavior so that there's prevention. People like Thierry have been mobilized over the last 40 years to fight HIV. Through their communities, through coming together, they've taken charge of their lives. And today we're seeing that where there's success in fighting COVID-19, they build on the work that communities have done and the experience that they have in fighting an epidemic. So communities are critical. We at UNAIDS, we work with communities, supporting them to lead their own responses and to do the response for themselves, not just to be part of a response, but to be the leaders of their own services. This approach works, we've proved it, and we are asking governments everywhere, we are advising governments, make communities the center of your responses, give them the means, the resources, and the space to speak, to demand, and to lead their own solutions. They know best. In a busy slum dwelling, they know best how to do social distancing there. In a context where no water flows through the pipes of a market, they know how to do hygiene in that context. So empowering communities, leading their own responses, marginalized groups, sex workers, gay people, people who inject drugs, can deliver services for themselves and treat each other with respect and fight their own for their own groups. So this is critical for us, and it is a part of the success of fighting epidemics.
Your voice is so clear, calm, and focused. May I ask you to use that same voice to focus us in on AIDS 2020 virtual. You're speaking here at the opening session of this very important social movement. How should we make the best use of the time together so that we extract the best of this opportunity of being in fellowship with each other?
At this conference, we are in a moment when the world is facing a huge crisis from another epidemic, a pandemic. We need to keep the world focused on the HIV epidemic as well, while also bringing our best experience into fighting a second epidemic. We will launch, UNAIDS will launch our global report on HIV. We'll bring all the data there. Others will come with the evidence of what's worked. Let us focus on using the evidence of what we have, understanding the epidemic and where it is today, and let us put communities at the center, human rights at the center, and people living with HIV in the lead. We can win. We must keep the world focused on the HIV epidemic and also be relevant in fighting a new pandemic that has devastated the world. We can't do both. We must focus the world on both.
Winnie, I just have to ask you one more question here, please. I can't leave without asking you, as the leader in the global AIDS response, what will it take to truly end AIDS once and for all?
It will take people empowered to fight for their lives. What we are seeing today is that AIDS has been controlled for the majority of people. People take their tablets and are able to live normal lives, long lives. But it is those whose rights are denied, who have to hide because they are criminalized, or who suffer inequalities that drive them to the bottom of society. They are the ones who still need the life-saving treatments that we have. So fighting on rights is key. Addressing the underlying inequalities in society is key. The right to health delivered to all people, we can end AIDS as a public health threat. And we will. Let's fight on.
Winnie Byanyima, thank you for embracing the world and for loving all of us within it.
Thank you, James. Thank you for the service you give.